Hello. Patient is a 27-year-old female with past medical history of anxiety and depression here for an evaluation after a recent ED visit. Patient presents today with a facial droop to the right side of her mouth and right eye. The onset was 3 days ago. The location is her right side of her mouth and her right eye. The duration has been constant over the past 3 days. The symptoms do not fluctuate in severity. The characteristics include facial numbness and difficulty seeing out of the right eye, which includes double visions intermittently. She describes her symptoms as nagging and dull. The aggravating factors include being fatigued. The alleviating factor is using an eye patch to help with double vision and to close her eye. The other symptoms she feels is anxiety and intermittent nausea. She denies any pain. Her treatment includes steroids, antivirals, and rest. On a scale of 0 to 10, her symptoms are a 5 out of 10. The patient states that she is having difficulty at times with double vision and just feels fatigued. She states that she went to the ED where they activated a stroke alert and did imaging of her brain. Her MRI results did not show a stroke. She was then discharged with a prescription for steroids and antivirals. She was given a diagnosis of Bell's palsy. She was told to follow up with her PCP. Her vital signs include blood pressure 130/70, heart rate 80, respirations 18 with a temperature of 98.6. On physical exam, she is alert oriented times 4. She is in mild distress. She has unilateral facial paralysis and cranial 7, which is causing a right facial droop, and she's not able to close her right eye all the way. She is unable to raise her eyebrows. The rest of her cranial nerves are intact. No decreased sensation. Lung sounds are clear, abdomen soft, non-distended with active bowel sounds. There is no peripheral edema, pedal pulses +2. Her affect is normal, but she is anxious. The assessment for this patient includes Bell's palsy, possibly from an inflammatory or infectious differential, including otitis media, HSV, or Sjögren's syndrome. TIA and stroke have already been ruled out. Plan would be to continue the eye patch to the right eye. Prescription for prednisone 60 milligram tablets, take 1 tablet by mouth for 7 days, and continue the valciclovir 1,000 milligrams twice a day for 7 days. May obtain over-the-counter eye lubricants to help with dry eyes or irritation from the eyelid drooping. The patient was instructed that she can take up to 4 to 6 weeks to resolve on its own, but with the steroids and antivirals, her symptoms should improve. I instructed her to return to the office if she has any new, persistent, or worsening symptoms. Follow up in 1 month for reevaluation.